Saturday session for the House of Representatives. A live look right now as members debate health care reform legislation, and a House vote could come later today. That is expected. Joining me live now, Democratic Congressman George Miller from California and Republican Representative Dave Reichert from Washington State. Gentlemen, good afternoon to you on this very busy day.
Thank you. Afternoon.
I would like to get your reaction to something that was said about this bill on the House floor just a little bit earlier this morning by Republican Congressman Dan Lundgren of California. Let's take a listen to that.
For the first time in history, as a condition of remaining in the United States, you must purchase something the federal government requires you to under the pain of a fine up to $250,000 and 5 years in prison.
Representative Miller, your reaction to that. First of all, is that true? Is that a correct assessment?
I don't think that's a fair characterization. What we have in this bill is an individual mandate. As we've learned from the Congressional Budget Office, from all of the economists, unless you get everybody to participate in this system, you have the same problems you have today with a lot of people going around the country who are not covered by insurance. They drive up the cost for everybody else who has responsibly purchased insurance. And what this plan does is it makes insurance available to individuals because we'll help them pay for that depending upon their income or their status if they're unemployed. Never again will they lose their insurance, but they'll be in a system that starts to drive down the costs because you don't have uninsured people showing up in the emergency rooms.
All right, Representative Reichert, your assessment of the characterization by Representative Dan Lundgren of California, is it fair? Is that an accurate assessment in your mind?
Well, it is accurate. There is an individual mandate language in the bill, and there is a penalty attached to the mandate. If you don't sign up for health insurance, you will be penalized financially, and if you don't pay the fine, there is jail time up to 5 years in jail. So what Dan Lundgren said is absolutely correct. What this bill does is really take away freedom, and that's one of the points that Republicans are trying to make today, is that this takes away our opportunity to choose. It takes away freedom, and it takes away your right to decide whether or not you want insurance, you don't want insurance, or you want a particular health care plan.
And for the first time, that'll be available to millions of Americans who don't have that opportunity today. They will be able to choose and afford a health care plan, and they haven't been able to over the last 50 years.
So what this really does, though, if you take a look at seniors, when the president says you can keep your health care plan if you want to, under the Medicare Advantage cuts, seniors, 14 million Americans across the country, are going to lose their health care plan.
Why?
Because they cut $160 billion from Medicare Advantage. Those people who are currently in Medicare Advantage will lose that coverage.
In other words,
those people will not lose their coverage. What they'll lose is the ripoff of where we see 14% more payment going to people, the providers of Medicare Advantage, for the same services that are provided for 14% less. We think we should recycle that into health care benefits. It's going to be a spirited debate today.
Benefits cut, premiums go up. That's the bottom line.
All right, well, gentlemen, we thank you for giving us a preview of that which is going to be happening in the very vigorous debate this afternoon. They're on the House floor. Best of luck to you both, Democratic Congressman George Miller of California and Representative Dave Reichert from Washington, Republican there. We are leaving Capitol Hill right now to take you to Texas.